Are we good, Beth? All right, good afternoon, everyone, and welcome to Partners Member Cafe. We are so glad that you're here with us today. So I wanted just to share with you that my name is Ann Gluff, and I am part of the member engagement team here at Partners Health Management. I also have a few of my teammates with me. Just wanted to introduce them if y'all just want to wave when I say your names. So first I have Beth Brooks, and then also Maria Shannon, Shirley Moore, Melissa Hatton, Lindsay Green. They are all part of our member engagement team. And then we also have our interpreter here, Jennifer. And of course, our guest speaker, Mike Darrow. And we'll share more about Mike in just a few minutes. So Beth, you want to go ahead and pop that slide deck up for us?
Para las personas que necesitan el idioma de español, tenemos el servicio de interpretación. Si usted quiere acceder a la reunión en español, por favor oprima la función de interpretación en la parte inferior, donde está el globo terráqueo, y ahí podrá escuchar toda la reunión en el idioma español. Gracias.
All right, thank you, Maria. So before we get started, let's just go over a few housekeeping tips. So just want to let you know that our meeting is being recorded. You will have the opportunity to ask questions. You can pop them into the chat, which is located at the bottom of your screen. You can just hover over the little bubble and enter them into a Q&A. Excuse me, not the chat, into the Q&A. And we will take a look at those questions throughout our presentation today. So I also wanted to let you know that the recording and the PowerPoint will be available to you on our partners website as soon as we can get it up and ready. So you'll be going to the partners website and going to the member education tab. We also have a raise your hand feature that's also located towards the bottom of the screen. And we can open your mic and you may speak a question or voice any comments when we get to that section of our presentation today. So what we're going to do today is we're going to have our guest speaker do a presentation about hunger. I know that's what you're all here for. We are also, when that is done, we will just share some general information with you about partners and how to access care through Partners Health Management. So let me introduce to you our main speaker. His name is Mike Darrow. He is the Executive Director of Feeding the Carolinas. Mike brings his unique background in healthcare and association leadership for profit and nonprofit experience, as well as Feeding the Carolinas battles food insecurity and the need for healthy, nutritious food across the Carolinas. Mike has degrees from Cornell University and Wake Forest University School of Business. So welcome, Mike, and I will let you take it from here.
All right, great. Thank you, Ann. Yeah, great to be here in the cafe. I don't drink coffee, but I have my Diet Pepsi with me. I am a Diet Pepsi-holic. Anyways, glad to be here. Glad to talk about Feeding the Carolinas, and also talk about hunger and food insecurity. And so what I thought I would do is speak just a little bit about Feeding the Carolinas and the Food Bank Network, so you have an understanding of kind of how all that works. And then a little bit about our impact and what we do, how we impact supporting our food banks and our friends and neighbors in North Carolina. And then talk about food insecurity and hunger and resources to help alleviate and what we can do as citizens of North Carolina, or as we know people, or perhaps yourself, that are food insecure. And so Feeding the Carolinas is a nonprofit organization. We are the state association of the 10 Feeding America food banks that are in North and South Carolina. And so I call them our capital F, capital B food banks. And I'll explain that in a little bit, because there's a difference between the big food banks and the little food banks, if you will. Anyways, we support those Feeding America food banks. There are 200 Feeding America food banks across the United States. 10 of those are in North and South Carolina. Every county in both states are covered by one of our food banks. In North Carolina, we have 7 food banks that we help support. They are all independent nonprofits themselves, and so we have an association where we help them. Our mission, as you see there, is to engage, educate, and unite to achieve food security for all in the Carolinas, all in North Carolina. That's our ultimate goal. Our ultimate mission is we'd love to not be sitting here talking about people who are hungry. So what we do, we primarily, there's kind of 4 buckets, if you will. We have a few things mentioned here. Networking and communication, brand awareness, if you will. What is the wonderful work that food banks do? What is food insecurity? How are we tackling it? Making people aware of what we're doing and communicating that. Raising resources is a big part of what we do, and that's raising funds, certainly, whether they're government or private or from individuals, as well as other resources like the North Carolina National Guard, who you may have seen out deployed at our food banks during the pandemic. And so we were instrumental in working with the state to get them deployed to help us with logistics, primarily with distribution of food. And that's an example of a non-funds kind of resource that we can help find. We also do advocacy work. We do lobbying work on public policy issues surrounding hunger and food insecurity. And disaster relief and support is a big part of what we do. My first day on the job was the first day that Hurricane Florence made landfall. And so Hurricane Florence and I both started the same day. And so I got to see immediately the impact of a major hurricane and the power of the network that is Feeding the Carolinas and how we supported each other during that. And now during a pandemic. Let me show you now where those food banks are. So if we could go to the next slide. Here's a list of the ones that are in North Carolina. And you'll see the names there. Again, we cover every county. All 100 counties has a food bank that supports it. Now, within each of these food banks, these capital F, capital B food banks are a network of what I call the small f, small b food banks. And that's your local church pantry, your local soup kitchen, your local community center, any place locally where you go to get food. In North Carolina, before the pandemic, we had about 2,700 of those scattered across the state, all underneath each of these food banks, all independent, mostly volunteer run. And so they would obtain their food from our food bank. And so our capital F, capital B food bank, if you will, are like multi-million-dollar distribution centers. That was their primary role. Of course, that has all changed during the pandemic, where we are doing more direct distribution of food. And so there's a network out there of all the way down to your local neighborhood level of where the food flows through that. So from the local, coming from the food bank, and Feeding the Carolinas kind of being there helping to provide support for that. The next slide shows you a map. It's a little tough to see, but gives you kind of a picture. It's very tiny print. But up there in the orange is Food Bank of the Albemarle. In the kind of the yellowish, I guess. The orange is Fayetteville. The blue in between, Interfaith Food Shuttle is in Raleigh. They cover mainly the triangle area, whereas the Food Bank of Central and Eastern North Carolina, which are those really light teal colored ones, covers 34 counties all the way down to the coast. And then you have the pink is the Second Harvest of Northwest, which is in Winston-Salem. The green is Metrolina out of Charlotte, and then Manna Food Bank up in the mountains in the Asheville area. And so that kind of gives you a picture of where each of these food banks are. And so now if we could go to the next slide, what I wanted to show you is or speak to is the impact of feeding the Carolinas and kind of what we have done to help our food banks through, in particular, through the pandemic. And so we don't directly give out food at Feeding the Carolinas. We support those that do. And so we're advocating, we're leveraging, we're supporting, we're sharing. And so with our operating budget, for every dollar that came in supporting our operating work, we provided $36 in support to our food banks. And that was from things like the CARES Act funding from the federal government, helping to lobby and advocate for that to get that to the food banks. The American Rescue Plan funds that are in the budget that is currently being negotiated between Governor Cooper and the legislature has money in for food banks in it. And so we're hopeful, cross our fingers, that that budget will be passed soon. From private foundations, getting money that we also distribute out. And then the next page, and again, I know this is a little bit small, but I'll speak to it. This just gives a picture of kind of our expenses and how we are very frugal and how we manage funds. The vast majority of what we get goes out to the food banks. We pride ourselves in that. The main program that we run is called Farm to Food Bank, where the only other employee I have is a Farm to Food Bank director. She works with local growers to get excess produce that we then provide to the food banks, our food banks, and even across the country, the Feeding America food banks, because we live in such a produce-rich area. And so I'm going to end the slides there because now I want to speak about hunger and about food insecurity. And so when we talk about food insecurity, what we mean is, folks that do not know where their next meal is coming from, or have had a point in their recent lives, recent history, where they were hungry or they went hungry because they didn't have food. And unfortunately, North Carolina has ranked highly in the list that you don't want to rank highly in across the country as one of the states that is high in food insecurity. That was a challenge before the pandemic, where about 1 in 7 adults, 1 in 5 children, were food insecure, and that's a shame. With the food resources we have in the United States and in North Carolina, that's really a shame. And so we are working hard to alleviate that. Well, then, a pandemic hit. And so you had increases in demand for people needing food of up to 50% almost overnight. And the majority of those were people who had never been to a food bank before. If you think about people that worked in a hospitality, worked at a restaurant, worked at a catering firm, they shut down. And so these were folks that were at lower wage levels that just could ill afford to lose their job, had been fine before, been okay. But when that hit, then they had some challenges in purchasing food. And so they came to us. The other thing that happened is those food pantries I mentioned that are run by volunteers out there in your local community, they're run by typically older volunteers who immediately and rightfully removed themselves to protect themselves from COVID-19 because they were in the higher risk category. And so we had a great number of our, what we call partner agencies, those local communities shut down. And then we had the supply chain issues of getting food, where suddenly we went from our budgets depend on donated food. And so pre-pandemic, our food banks would spend on average $80,000 a month on food, on average, with the bulk of it being donated. That went to $1 million a month per food bank to purchase food overnight. And so all of that hit us. And so we had to kind of dive in and figure it out. And we did. We've had tremendous support from the community and from the government and from private folks. And so what our food banks do is a combination of supplying the partner agencies, as well as, and you've probably seen this, going out into the community with a box of food, shelf-stable food, also with perishable, some produce, fresh produce, and going out and doing what we call a mobile distribution, where people would drive through hundreds of cars, 400, 500, 600, which represent about 1,200 to 1,300 families, because every car is not just one family. And we would go out and do that on a day, on a Saturday and a weekday. And that continues. And so it's been a challenge, but the people of North Carolina have stepped up. So that's a picture of kind of where we are and how we function. Now, how does one get food? Let's talk about that in just a moment. And so there's a couple different things that are available and out there. One resource that I like to talk about is called 211. It's a service of the United Way where you can call 211, just like you're dialing 911. You would call 211, and it is a clearinghouse for all kinds of human services, whether it's I'm looking for food, I'm looking for shelter, I need help with my electric bill, I'm homeless, I need mental health suggestions, a whole gamut of items they have in their database at the local level. And so I can call them, I live in Winston-Salem, I can call and say, I'm in Winston-Salem, I need help with paying my power bill, is there anyone out there? And they can help with that. Now, the challenge with 211 right now is with the pandemic, their system has been overwhelmed with calls. And so there's actually, again, money in the budget to completely revamp and update their system, which is badly needed. And so be patient if you call that number, but it's a great resource. For food in particular, each of our food banks has a search function, but to make it easy for you, you can go to our website, and we'll put that up in the chat here a little bit, but it's feedingthecarolinas.org. And if you click Find a Food Bank, on there, you can put in what county you're in. I can put Wake County, Davidson County, and it will show me the food bank that supports my county, the Feeding the Carolinas Food Bank. And under each food bank, there are 3 links. One that says donate, if people want to donate to the food bank. Volunteer, if people want to volunteer, which is badly needed because we run it very heavily on volunteers. Or find food. And so when I click on find food, it goes to that food bank's website. I can then search down to the zip code or the city, the town I live in, and it will show me the resources that are available with their contact information. Again, each food bank has that. And so if you know who your food bank is, you can go direct to them. But we've tried to make it easy. And the other thing that we have now too is if you're on your phone, rather than going to our website, you can actually text food, the word food, and we'll put this number up at the end too, to 888-689-1447. And we'll put that up in the chat, but it's 888-689-1447. And when I text food, it'll come back and give me a link to our page on our website. Or if I text donate, it gives you a link to our donation page. Or if I text volunteer, a link to the volunteer page. And so that's a new system we've just put in, and it actually pops up on our website on the homepage. And so that's a little picture of where there are resources for food. Now, the local partner agencies, the local food pantries and all, are ever changing a little bit now during the pandemic. Their hours may change, whether they're open or not may change, because again, they're still trying to get back, as people get vaccinated and are more comfortable volunteering, then they can open. And so it changes a little bit. And so it's hard to keep up with. But in general, when you go, you can find those local resources. So there's a couple places, 211, our website or one of our food banks websites. And the most important thing for us to remember, and I talked about this early on in the pandemic, I did a video about how can we help. The most important way that we can make sure people have food is checking on our neighbors. Because I believe, food insecurity or hunger or healthcare issues or many of those issues are not a government issue or not a government challenge. It's a local community focus. That's where all our solutions are at the local community, I believe. And so it's important to make sure if we have an elderly neighbor, that just check on them and make sure that they're okay. Make sure they have food. Make sure they have, they have power or whatever. And so that's something that we can all do. And we can donate food to our local food pantry or donate funds so we can purchase the food. We can buy bulk food at a much better rate and buy what is needed. And so there's a lot of ways to help. There's a lot of ways to get resources. And so I'm going to stop there because I've said a lot. And so we'll see if there's any questions or anything else we'd like to talk about today.
Thanks, Mike. That was a lot of great information. Wow, I knew things had increased with food banks, but I did not realize to the exponential level that it had gotten to.
And we're still on average 20 to 30% still increased. And so it's going to take a while as the local economies settle out. And so, right. We continue on.
Great. So Beth, do we have anything in the Q&A? I am not seeing anything right at the moment. Okay. So we'll just wait a moment here to see if anybody has any questions for Mike before we move forward.
I can go ahead and I'll put that phone number in the chat.
Okay, that'd be great. All right, so I think what we're going to do is we're going to go ahead with the second half of our presentation. Mike did drop that information into chat, so you all can copy and paste that information for future reference. And let's talk a little bit about Partners. So Partners Health Management is an insurance company, not insurance company, insurance plan for Medicaid. And state funding. So we are Partners Health Management, but we go by Partners. We are known and recognized across North Carolina for our community model and our commitment to our counties and families that we serve. So that's really where our focus is. So when you think about Partners, some people, you may hear them call us a managed care organization or a local management entity. We are contracted by the state government to administer Medicaid on the behavioral health side for intellectual disabilities, mental health, and substance use disorder. So I want you to just think about Partners as part government agency and part insurance. So we don't provide services directly, but we do administer those dollars, their tax dollars, and we provide service through a network of providers. They're agencies in your communities that provide the services. But our goal is always to improve lives and strengthen communities by focusing on positive outcomes for our members. And one last thing before Beth flips that slide. Oops, she already did, and that's fine. I just wanted to focus on that 24/7 crisis line that's right at the bottom of your screen. And I see Melissa drop that into the chat for you. And so that is our access call center for behavioral health concerns or for crisis. So you can call that line 1-888-235-HOPE or 4673. And again, that is available 24/7. And our access call center will answer. If there is a crisis, you're going to be immediately put over to a licensed clinician. So now we can go ahead and flip to the next slide. And so just wanted to share with you that we do serve 14 counties. So there are all the counties listed there for you. So we recently welcomed Cabarrus, Stanley, and Union in September. And then just November 1st, just a little more than a week ago, we welcomed both Davie County and Forsyth County to our serving area. So I want to let you know that if you have questions for partners, we really encourage you to reach out at any time. You can see a email address on your screen there, and that's also being dropped into the chat as well. countyquestions@partnersvhm.org, or you can call the phone number there, 833-589-2184, for any questions that you may have related to your county about partners. And you can certainly always go to welcometopartners.com to view any information that we've previously recorded. Any information is available for you there as well. So next slide, please, Beth. All right, so member engagement. I shared with you earlier that I am part of member engagement. I'm a member engagement specialist, along with several other folks that I introduced you to as we got started. So the member engagement team here at Partners supports through advocacy, education, and navigation of our North Carolina behavioral health system. And we're here to build strong partnerships. We do that internally with our departments so that we can support our individuals and families. We also work together with our providers and other community agencies, that are stakeholders in the community that work together with you. They support you as well. And so we always want to be sure that we are providing the best care possible for our members and that you have the resources that you need for continuity of care. So if you want to reach out and contact member engagement, if you take a look on your screen there, right in the center, you'll see a phone number for member engagement directly. It's 704-884-2729. So when you call this number, you will go directly to the member engagement team. And you might want to call here if you're not sure who to reach out to. You don't know if you need to call the Access Call Center, you have a question, and we're there to talk with you, help you navigate our system, and we will get you to the place you need to be to get the help you need. You can also reach out to us through email at memberquestions@partnersvhm.org. And then, of course, you can always go to our website, partnersvhm.org, and you can download the latest member handbook or find additional information. Log on to your member portal if you are currently one of our members. And then you're also going to see Partners Health Management in social media. Facebook, you're going to see us there. If you're on Twitter and you like to tweet, you may see us there as well. And then also on Instagram. So one thing I did want to share with you, if you do reach out to Partners via email, when you get a response, it's going to come back looking a little bit like what you see on the screen. Not a little bit, exactly like what you see on the screen. So we're required to keep all of your healthcare information and everyone's healthcare information secure and private. So Zix Corp, which is where how this goes through, is how we send our external messages to you to make sure that everything is safe. So it's going to look like this. You're going to click on the open message. And then if you have not yet received a message from us, the first time you get this message, it's going to look and show you, there you go, it's going to look just like this. And what you're going to do is you're going to register. So you're going to enter your email address, put a password in there. And once you're in there and registered, each time you get an email from us, you'll be able to click on it and access it easily. You do need to remember your password, but again, this is going to help keep any private information just that, private, so that it's not, so it's secure and stays between you and Partners Health Management. So let's talk a little bit about our website, partnersvhm.org. So I encourage you to go there. check it out. If you go to the website, you can go to Member Connect. That's our member portal. So if you are a member, you can register there and receive updates and health information. You can also go to the member tab. And so that word member, what that means is any of our individuals and families that are supported by us in the community, that's you, a member. So you're a member of Partners Health Management Health Plan funded by Medicaid or state funding. So under that member tab, you can find information about crisis help, some education. You can search for a provider agency. I mentioned earlier that we don't do direct treatment, but our providers do. And that's where you're going to find your providers. You're going to find information about getting services. We also have some options to do some screenings online. You can click on those screenings, and that's going to help you do just a quick, short self-assessment and help you to know whether you really do need to reach out for help. We also have additional resources in both English and Spanish. There's a calendar out there as well that's going to show events like this and others that are going on to help with education. So our PICS Health mobile app, what a great app this is. This is something fairly new in the last year here, I think, the PICS Health mobile app. This is something that you can access on your phone. You see right there in the center of your screen. It's www.highpics.com, and you can download this app. So this app is focused on self-help. It is focused on helping you with daily mood and wellness check-ins and screenings. So it's full of helpful tips and helps you live a healthier life. There's a sweet little chat bot on there. His name's Pixar, and he's going to communicate with you and just help you move along each day. So I encourage you to check this app out on your phone. One more thing I want to say about the PICS Health app is that when you are communicating with PICS Health, there is a compassionate call center. And if you do reach out to them, you'll get a phone call from them, and the individuals who make those phone calls, they are peers, meaning that they maybe have had experience with behavioral health or intellectual disabilities, whatever you may be calling about. The other thing that you can access on our website is Aunt Bertha. So Aunt Bertha is a resource online that you're able to pop into and get additional help. It could be that you have some questioning about housing. It could be that you're looking for transportation, or maybe you're locating one of those food banks that Mike shared a lot of information about. Not only can you go to Feeding the Carolinas, you can also go to Aunt Bertha, pop in your zip code, and it's going to give you some resources that are general to your area. So who to call? If you are receiving services, or you need a referral to provider, or you have questions, let me back up a little bit there. If you're already receiving services, your first connection to partners is to go ahead and call your provider, especially if there's crisis going on. For any other services, or if you need assistance, you want to call our Access to Care department. Again, that was the one I mentioned earlier, available 24/7. The number's right there on your screen. It's that 1-888-235-HOPE 4673, and they're going to support you there. If you're already receiving services and you have a partner's care manager, or used to be called a care coordinator, they are absolutely your first responder to anything that you are looking for. And again, I'll go back to member engagement. If you're not sure who to talk to, not sure if you need that Access to Care department, you can call member engagement. The number is there on your screen for you. Again, it's 884-2729. And think of member engagement as an extension of customer service from our Access to Care Center. And again, we're there to help you navigate and talk with you, help you get to where you need to be. And you can also email us at memberquestions@partnersvhm.org. So Medicaid transformation and transitions to care. Wow, there is so much going on out there about Medicaid, all the changes that are happening. It's been happening for the last, several months here where you're switching over to a different plan. You're under Medicaid, but you may be connected to what we call a standard healthcare plan. So standard plans are still Medicaid. You're still working with providers. And if you need to make a change, you can reach out to that healthcare company. If you have something more complex that's going on, you may need to make a change. And that standard plan provider is going to be there to help you. The member or the guardian needs to make that request. You can go through the standard plan or through your provider to make those changes. So North Carolina Medicaid is then going to review that request that you put in and transfer the member to where they need to be. They review it and make sure that everything is happening within 1 business day. So another place who to call with your standard plans, or you're not sure where you're supposed to be, you can call the Enrollment Broker at 1-833-870-5500. They're going to help you with the standard health plans and help you make a selection or point you in the direction of where you need to be. If you have questions about your plan and you need some help because you're not sure you're getting what you need, you're not sure which way to go, you can also call the North Carolina Medicaid Ombudsman at 877-201-3750, or you can visit the website at northcarolinamedicaidombudsman.org. There is also an ombudsman for our providers as we've made all of these changes within Medicaid. There's a phone number there on the screen for our providers, as well as a website, Medicaid Provider Ombudsman at dhhs.northcarolina.nc.gov. So I wanted to share a little bit with you about the Registry of Unmet Needs. You may or may not have heard of that. So the Registry of Unmet Needs is a waiting list, and it is a waiting list for the North Carolina Innovations Waiver, which is a set of services focused on individuals with intellectual and developmental disabilities. We have a group in the Triad area, an advisory board, that developed an action committee connected to this wait list. You can see that's their tagline there, too long to wait. So right now there are over 15,000 people waiting for services for the North Carolina Innovations Waiver. And this group is doing a great job at getting our legislators' attention and how it is absolutely too long to wait. So if you want more information about this action team, maybe you want to get involved, you're going to want to go to the website that's on the screen. Melissa just dropped that in the chat for us as well. It is ncwaiveractionteam.com. Grievances. So the other part of Partners Health Management is we always want to hear your voice, and you have the opportunity to file a grievance, which is also a concern or a complaint. It's a way to express your dissatisfaction. A lot of words for me today. Dissatisfaction with matters involving partners or perhaps a provider in the network. So you can file a grievance about any matter other than the official action to deny, reduce, or suspend or terminate services. but it's just a way for your voice to be heard and to have the opportunity to hear how the grievance is resolved. So how do you file a grievance? So you can call that same phone number, 888-235-HOPE-4673. You also can mail to Partners Health Management. There's the address right there on your screen in Gastonia. That's our main office. You can also send an email to grievances@partnersbhm.org, or you can go online to use our feedback form that's located at the link that you see there, partnersbhm.org/feedback. And I also just want you to know that any employee at Partners can take your grievance. So if you want to make a phone call, you can talk to us in member engagement or any other individual here at Partners that you're connected with, and we can help you with that. So our Human Rights Committee works to ensure that individuals' rights are being met. So Shirley Moore, who you met earlier, she is connected with our Human Rights Committee. And our Human Rights Committee ensures procedures and plans do not violate human rights and works to ensure needed services that are offered in the Partners service area. So if you want more information, you can contact Keisha Sandage at 704-884-2689, or you can email her. And there's her email on the screen there, and I think we're popping that into the chat as well. Keisha Sandage at partnersbhm.org. That's K Sandage. And our CFAC, our Consumer Family Advisory Committee, again, Shirley is connected with that as well. So CFAC is a volunteer group made up of members and family members representing those who receive mental health, substance use, and traumatic brain injury and IDD services. So the CFAC members advocate for those individuals to improve the public behavioral health system and is looking for members. So for more information, please contact Shirley. There's her phone number there. Or to find out more information, you can go about Partners CFAC by visiting partnersbhm.org/Consumer Family Advisory Committee. I'm sorry, Shirley, I stepped right into your shoes there. I was just walking right through those slides. So do you have anything to add there, Shirley?
No, just want to reiterate that we are looking for members is most important to our CFAC committee, that every county, every discipline be represented. So please reach out to me if you are family or if you are a member or someone in our community that's affiliated with our families and members. Please reach out for more conversation about CFAC. We do have our applications on our website, which Ann has shared with you, partnersbhm.org. And you can find those applications in English and Spanish. So please don't hesitate to reach out. Thank you.
Thanks, Shirley. You said that much better than I did. You are absolutely the expert with our CFAC committee. So you can go ahead and go on to the next one, Beth. So I really want to encourage you to stay in touch with us. One of the things that's really important is that you keep your contact information up to date here at Partners so that we are able to reach out to you when needed. Especially if you're on the registry of unmet needs, you're waiting for those services, you always want to make sure your contact information is up to date. If you receive Medicaid and you move to another location, you not only want to contact Partners, you also want to contact your local Department of Social Services, DSS, to update your information. Super important that we have all of that contact information up to date so we can contact you or DSS can contact you with any changes. And then of course, if you receive state funding, contact partners at 888-235-HOPE-4673 to update any information about a location change. So it is now time for any questions and comments. But again, you can also email us at memberquestions@partnersbhm.org or give us a shout out at the phone number on the screen. So I don't see anything in Q&A. Beth, am I missing anything? Do we have any questions up on the board? All right.
I don't see anything yet, but please feel free to pop those into the Q&A and we'll be happy to answer them.
Yeah, so we'll just give a few more minutes here to see if anybody has any questions they want to. Feel free to raise your hand and we can open your mic up so you can speak, or just drop it into the Q&A.
And I don't have a question. This is Shirley, but I do want to thank Mr. Darrow for his information. I support Second Harvest, and but I live in South Carolina, so I was glad to get your information so that I can find out a location for me to support in South Carolina as well. So thank you so much.
Great, you're welcome.
So I opened up Tanya Freeman's.
Okay. Thank you. So I had a question, but I was driving, so I couldn't type, and it wouldn't let me do my microphone to text. So if someone has no insurance and is not Medicaid eligible and need mental health treatment and services, can they come in and or call partners and get services or get connected to services?
So yeah, Tanya, was that right? Yes, Tanya, I would encourage them to call the number and talk to our Access to Care line. It depends on the individual and what's going on, but we certainly don't want anyone to be without service and would like to help as best as we can. So I would encourage them to call the 1-888-235-4673 to get support. Anybody else have anything to add to that?
Well, the reason why I asked, I work for an agency, we're a community service provider. And oftentimes I come into people's situation where they need access to mental health treatment, but for whatever reason, they are not eligible for Medicaid or have not got their Medicaid activated. And they need to engage in treatment sooner rather than later. And I wanted to know this information so that I could know how to guide them.
Right, so the Access to Care line would be one way. The other, and Access to Care could let you know these locations. So if you look on Partners website, you'll find what are called walk-in centers. So depending on what county you live in and where you're at, there are different walk-in centers. And that is where you can walk in that day, give your information, and that can be indicated whether they're eligible to get service or not at the walk-in clinic and for mental health, substance use.
Okay, thank you.
You are very welcome.
And we have another question in the Q&A. It says, maybe I missed it, but I've been hearing that transportation is an issue, especially when it comes to being on time. What is the plan for transportation? Well, that is a very common theme that we hear a lot. And so if someone has Medicaid, then they can access the non-emergency medical transportation in their county. So that would be one way to address transportation. And then we look at other ways, but there's not always a clear answer. Ann, do you have any more to add?
You said exactly how I would say it as well, is if you have Medicaid, there is Medicaid funded transportation for certain things, for medical visits, that kind of thing. And that you would access by calling your local DSS. And again, it just is going to depend on your area as to how it's accessed. It seems to be different from county to county, but that is a very common issue. Hope that is helpful.
So there's another question that says, speaking about transportation, is there any resources that you know for uninsured people? It kind of, again, depends on your county. In Surrey County, we have a transportation service for people who have no insurance and need to get to their services, but that's just in Surrey County. But it again depends on your county.
Right, I agree. It depends on your county. And you would want to reach out to your local DSS, your local county health departments to gather that information.
Do you credential for transportation for individuals wanting to provide this service to disabled and IDD population? Something that we would have to research.
Yeah, we would have to research that question, and we certainly can do that for you. Because that I definitely don't know the answer to that one. So, but we can take that question back, Danica. And if you want to reach out to us at member engagement, or if you want to just pop your contact information into the chat or the Q&A section there, then we can get back to you. All right, any other questions? All right, thanks, Tanika. We'll grab your email address there. All right. So I want to thank you all for joining us today for Member Cafe, and special thank you to Mike Darrow from Feeding the Carolinas for joining us and being our guest speaker. And thank you all for choosing to spend your time with us this afternoon to learn more about hunger and Feeding the Carolinas and Partners Health Management. So we will say, have a great afternoon. So bye, everybody.
Yes. Oh, one more thing.
Okay.
Tanya asked if these sessions are recorded, and they are, and they will be up on our website. It is under the member tab. And if you are struggling to find it, you can always reach out and we will help walk you through that. So you will be able to view these later on. And also there is a survey that we ask you to fill out as soon as this ends. It will generate, and please feel free to give us any suggestions on what you would like to hear in the future. So thank you again for joining us.
All right. Thanks, y'all. Have a great afternoon. Bye.